Addiction is a complex psychological phenomenon with various contributing factors. Here are some key aspects of the psychology behind addiction and approaches to treatment. Biopsychosocial model. Addiction is often understood through the biopsychosocial model, which recognizes that biological, psychological, and social factors all play a role in the development and maintenance of addiction. Genetic predisposition, brain chemistry, trauma, mental health disorders, environmental influences, and social dynamics can all contribute to addiction. Reward circuitry. Addictive substances and behaviors affect the brain's reward circuitry, primarily involving neurotransmitters such as dopamine. Dopamine is released in response to rewarding stimuli, reinforcing behaviors associated with pleasure. Over time, repeated exposure to addictive substances or behaviors can lead to changes in the brain's reward system, resulting in tolerance, dependence, and craving. Psychological factors. Psychological factors such as stress, trauma, low self-esteem, and underlying mental health disorders, e.g., depression, anxiety, can contribute to addiction. Individuals may use substances or engage in addictive behaviors as a way to cope with negative emotions or to self-medicate underlying psychological issues. Cognitive processes. Cognitive factors, including beliefs, attitudes, and cognitive biases, can influence addiction. For example, individuals may hold beliefs that minimize the risks of substance use or overestimate their ability to control their behavior. Cognitive biases such as attentional bias, e.g., heightened attention toward cues associated with substance use, can also contribute to craving and relapse. Behavioral reinforcement. Addiction involves learning processes, with addictive behaviors reinforced through positive reinforcement, e.g., pleasure from substance use, and negative reinforcement, e.g., relief from withdrawal symptoms. Environmental cues and situational triggers can become associated with substance use, leading to conditioned responses and cravings. Treatment for addiction typically involves a comprehensive, multidisciplinary approach that addresses biological, psychological, and social factors. Some common treatment modalities include detoxification. In cases of substance addiction, detoxification may be necessary to manage withdrawal symptoms safely under medical supervision. Behavioral therapies. Therapeutic approaches such as cognitive behavioral therapy, CBT, motivational interviewing, and contingency management aim to modify maladaptive thoughts, behaviors, and reinforcement patterns associated with addiction. Medication-assisted treatment, MAT. Medications may be used to manage cravings, reduce withdrawal symptoms, and support recovery for certain substance addictions, e.g., opioid addiction, alcohol use disorder. Support groups. Participation in support groups such as Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, can provide peer support, encouragement, and accountability in recovery. Lifestyle changes. Healthy lifestyle changes, including stress management, regular exercise, nutrition counseling, and social support, can help individuals maintain sobriety and improve overall well-being. Overall, effective treatment for addiction requires a personalized approach that addresses the individual's unique needs and circumstances, while also addressing the underlying psychological factors and providing ongoing support for long-term recovery.